Are you a woman standing at a crossroads, eager for change? It's time to connect with your authentic and empowered self at Boss Leap. Join Dr. Sylvia Morris and Dr. Angela Walker in this empowering community where real-life stories of courageous and talented women inspire and motivate. Engage in honest conversations that foster well-being, drawing from our own journeys. Let us guide you toward profound growth and transformation in both your personal and professional life. Here are your hosts, Dr. Sylvia Morris and Dr. Angela Walker.
Welcome back to Boss Leap Podcast. I'm Dr. Angela Walker.
And I'm Dr. Sylvia Morris. And at Boss Leap Podcast, we sit down with founders, visionaries, and difference makers who decided that their purpose was bigger than one lane. And today is no exception.
Our guest today is a board-certified OBGYN, minimally invasive surgeon, speaker, and founder who is literally rewriting what it means to be a physician in 2026. She chairs not one, but two hospital committees, the Ethics Committee and the Robotic Surgery Committee, which already tells you everything about the kind of leader she is.
She's also the founder of the No You Studio and the voice behind the Fibroid Fixer, where she's turning complex medical information into clear, actionable insight that women can actually use. Her whole mission: when women understand their bodies, they make better decisions.
Dr. Gamilah Pierre, welcome to Boss Leap Podcast. We have been looking forward to this one.
Thank you for having me. It's great to see you, Angela. Nice to meet you, Sylvia.
Nice to meet you as well.
So our little backstory is Gamilah and I trained in residency together, and I knew she would be as fabulous as she is today. So I'm very, very proud.
So Dr. Pierre, again, welcome to Boss Leap Podcast. You are a surgeon, a founder, a speaker. Let's take us way back. When did you know you wanted to become a doctor?
I thought about this question, and I cannot remember a time where I didn't want to be in healthcare. However, I wanted to be a dentist, believe it or not.
Really?
I always wanted to be a dentist. I'm a little kid who would, instead of playing dolls and teacher, I would play dentist. That's very strange.
Were you pulling out teeth?
I had all kinds of little tools, and probably because I went to the dentist a lot. So I wanted to be a dentist. I kind of always assumed I would be a dentist. And it was when I was preparing for the DATs that reality hit me that perceptual ability test was not my lane.
Wait, so is that?
Explain that.
What is that?
So, if you think about it, dentists do everything backwards with a mirror. Yes. And in preparation for that, so, we have our MCAT. So they have the DAT, which is pretty similar, but they have this whole separate component called perceptual ability test. And it's all spatial visualization. How does the diagram look? Or they'll have a cube that's split in a puzzle, and you have to figure out what it looks like on the other side.
Oh.
But you're a surgeon, and surgeons...
Not the same.
It's not the same? Okay. I'll give the internist in the conversation. All right. Got to see everything. Okay.
Yeah. I was doing those puzzles because they literally do everything with a mirror. So everything they do is backward. And I said, this is too hard. I'm not doing this.
It sure is.
And then I said, I think medical school would be easier than these puzzles. So... And
that is hilarious.
So yeah, literally, I was always wanting to be a dentist right up until, rubber meets the road, and they say, well, you have to do these quizzes and puzzles. I was like, not for me. So
wow. Was there anyone in your path that was in medicine, or anyone that influenced you at that point or before?
My uncle is he's since retired, but he was a respiratory therapist, and at Herman Life Flight. And, I was...
That's in Houston, right?
Yeah, exactly.
Okay.
And I was a little bit sickly. I had asthma. My uncle had asthma. So I kind of grew up, in the hospital ER. And I think because my uncle would bring me these coloring books on the lungs and I mean, all kinds of strange things. No one was a doctor, but I think that really influenced me. My mother worked in healthcare administration even when I was a kid, and I always had to go to work with her in the summer. You know, I had to go, and I was like, this is boring. So I was always around a healthcare institution, even though nobody was actually a doctor. So that's why I said I really don't remember a time where I didn't assume I would do something in healthcare, but it just turned out a little bit differently than I expected. And I never thought I would do OBGYN.
Yeah, I don't know. A lot of us come in absolutely knowing until you know, right? So you talk about transforming women and their experience in healthcare, and that's a bold word, transform. So was there a specific patient encounter, a moment in a room that made you realize the system wasn't just imperfect, but actually needed a reckoning?
No, I think what it was one too many patients coming in. You know, I do a lot of second opinions. And one too many persons said to me, wow, you made that really clear. Nobody ever explained that to me before. And I thought, well, what do you mean? Isn't everybody going over all these, this information? And literally people were saying, nobody's ever just sat down and explained, this is what a fibroid is. This is what your uterus is. And I thought, well, it shouldn't be that complicated, but apparently we've been missing that. We haven't been giving patients that. And I think what happened is because we in healthcare weren't giving people what they needed, they started to seek it out anyway. And then I ended up in this social media because I realized they were seeking it out among people who weren't qualified to give them the information. And I said, well, heck, I realize they're doing this, but it needs to be coming from us.
Yeah.
And I started seeing people, just talking about things. People would come in with their education and it was random, weird, bogus things. And I'm like, where are you getting that? And so I realized that there was a lot of information out there, but a lot of it was bad information.
So there is a lot of disinformation is what I would say, or misinformation.
And I would argue to say that there are many of us that do like to educate, and had an experience this week of I had a patient with like her eyes were deer in the headlights, like it was like too much information. But I think by and large, I agree with you, but I think because of like the constrictions that we have in medicine, the time, I mean, to adequately educate somebody about her anatomy and fibroids in a well woman exam, that's just, it's not enough time. And so sometimes you have to explain that this is a problem you need to come back and we have a full conversation about. But I just think that now with, like you said, social media, it's in the forefront. And so sometimes there's not the opportunity to do that in the exam room because there's already been the miseducation. So I like that you are now in social media and educating. And I know that was necessary. You didn't think that was your forte, but it definitely, I've watched your videos. They're excellent and great educational tools. So we appreciate
By the way, I've never seen my videos, so I hope they're okay. I don't watch them.
Are you kidding?
No.
So I would highly recommend that you watch your own stuff.
I know that is ignorant, but
you will.
You're gonna. It's hard because we're so very self-critical, right? So I just figure if I don't know I look crazy.
What you don't know can hurt you, Dr. Pierre, but we're going to leave that alone. But let's stick to the social media for just a moment. And, certainly as a physician, you're blending both medicine and media and then your own personal mission. Sometimes we think about that as kind of a risk to our credibility or our standing with our patients. So how do you navigate that tension?
That is 100% a great question for me because I thought it was hokey. I'm not going to be a cheesy influencer. That's weird, but I don't know what these people are doing. And it was patients who kind of said, "Oh, well, I wish, my sister could hear you, or I wish my friend could hear you." And they live in, and I was like, "Oh, well, they can see me." And they're like, "Oh, they live in Alaska." And I said, "Oh." So I started thinking, well, maybe I could do a fibroid channel and I can just talk about fibroids. I really enjoy that. So I thought that would be a lot of fun. And that's how it started. And then I knew that my hat is off to you guys. I tried to do it YouTube and Riverside and do all that, and it was really hard. And someone who I work with, her husband, she said, "Well, I can help you with your social media." So she saw the vision that I had more than I saw it for myself, and she's really encouraged me. So that's kind of how it started. I still refuse TikTok. I was like, "There's no way I'm doing TikTok." And she said, well, "We'll start with."
Can you tell us why no TikTok?
Yeah, because I'm old, and for me, TikTok was people dancing and doing dances. So one of my patients came, and I was all excited. I said, "I started an Instagram and I have a YouTube channel." And she said, "Are you on TikTok?" I said, "Oh no, I'm TikTok, no." She said, and I was like, "I'm not doing that." And she said, "Well, you need to get on TikTok." I said, "I'm not doing that." So she said, "You think it's kids dancing?" I said, "Yes, I do." And she said, "It's not. And that's where I go to get information." And so you need to go. And I was like, "Really?" So I left that room and I went in, I texted my social media manager. I was like, "Fine, set up the TikTok page." She was like,
Wonderful.
"Yeah."
Wonderful.
Oh, great. Well, we're going to share out.
Jumped onto TikTok, but
awesome.
people are educating themselves on TikTok. So
yeah. And so since we're talking about on this same lines, the social media and your platform, the title is The Fibroid Fixer, which I love. It's direct, it's confident, it removes you from kind of like, the shame of talking about bleeding and fibroids and tumors. It's and the fixer means that there's actually something that can be done about it. How did you land on fibroids in general as your platform? And what do most women still not know about them that they absolutely should know that you can share with our listeners?
Every woman in my family lost their uterus by the time they were 40, pretty much, except me. I'm the only one who kept their uterus.
Wow.
They all lost them due to fibroids. So fibroids have been something I've known about before I was a doctor. Never thought that much about it other than everybody's got fibroids. And, I went through my own experiences of, I call them period rituals. You got to do this, you got to, prepare to go to sleep because of all this bleeding. And it's kind of humiliating, right? And when I finally had patients who were coming and I could complete their period ritual for them, they were like, "Oh my God." Like I could say, "Oh yeah, you sleep on towels," or, "Oh, you have to know where the bathrooms are." And they were like, "You understand what I'm talking about?" Because people have been ignoring these patients, which I found strange. At the same time, I really got into robotic surgery, and I realized that we can really do some nice cases. Some of these really large uteruses, we're able to do them robotically. We are able to get these people back to work soon with minimal complications. I've been really grateful that because of robotic surgery, I will take on my Jehovah's Witnesses, where a lot of doctors won't operate on them because of the risk of blood loss. And I'm like, but with robotic surgery, we lose very little blood. So
Dr. Pierre, I'm going to interrupt you for a moment.
Sure.
Can you kind of explain to our audience what minimally invasive surgery is? And when you say robotics, does that mean you're in the room in the OR? Does it mean you're in the gallery? Kind of help explain what that is.
So minimally invasive surgery is anything where we don't make a large incision on your belly. So it could be vaginal surgery, that's considered minimally invasive, laparoscopy, and then robotics. So robotics specifically uses very small incisions. They're about that big, maybe about 2 centimeters, 1.5 centimeters in various areas. And then we have an actual robot. And the cool thing about the robot is it's a wristed instrument. My whole wrist will work. when we do laparoscopy, which has been around for many, many years, it's more like operating like this without the use of your wrist. But
Really?
robotics, the actual wrist moves more than my wrist. It's 300.
Is that better? And that's better because you
can
why is that better?
So when you're operating like this, first of all, for the surgeon.
And when you say like this, for our listeners, your arms are extended and you don't have you cannot flex or extend your wrist.
Think of like chopsticks. And you're operating with your arms straight. So for the surgeon, it's very fatiguing, first of all. Your neck is tired, you're hunched up. Robotic surgery now allows us to use the natural motions of our hands, our wrists. In fact, it's even better than our actual wrist. So and also the visualization of the actual camera is amazing. So what happens is with robotic surgery, even better than open surgery, open is just traditional surgery, I can move that camera this close to me if I need to, which I can't do to your uterus. And if we're just open, I can't move your uterus to me. But with robotic surgery, I can move that camera this close to me and see things that we never used to really see before. So we can,
kind of like when I get a photo on Instagram or a photo and then I tap it and then I just make it bigger so I can actually see the writing.
Yes, exactly.
Okay. All right.
So
I'm with you.
The surgeon, first of all, it allows us to see areas that we couldn't see before. So we're able to be more precise with our surgery. It allows us to also take down scar tissue, because a lot of these patients, especially fibroid patients, if they've had previous surgery, they have a lot of scar tissue. But with the robotic technology, we can get so close to that scar tissue that we take the scar tissue away, but not harm anything important like your intestine.
And why is it important, or why would you remove scar tissue?
So
does that make me have less pain, more comfortable? Why remove the scar tissue?
Sometimes we remove the scar tissue because of pain, but sometimes it's so we can complete the surgery. If the scar tissue is in the way, I can't get to the uterus. And so I have to take the scar tissue away to get to my end goal. But sometimes the scar tissue causes pain as well.
And also scar tissue, if it's scarred to an adjacent organ, so bowel or bladder, then we only want to be operating on the uterus itself, not the bowel or the bladder. So you may remove scar tissue so that you're releasing other organs from the operative field that you're working in.
Okay. All right. Well, we just went down the rabbit hole, but I think that was important to help to explain. Yes.
Let me say one thing, because my patients ask me this all the time. Are you in the room with me? Yes. We're about.
But I wondered. I kind of knew, but I didn't know. You say robotics. Yes.
Exactly. People ask that all the time. But I will tell you, there's some crazy technology right now where we have our hospital, we actually have a lot of robots. We have 6 robots, which is a lot for a community hospital. We have 6 robots. So we've got a lot going. And we have 2 of the newest robots, the newest robot, we have 2. This robot is so cool. It allows me to be looking at doing my surgery, and my colleague can be looking at it from Atlanta and saying, hey, what do you think about this? This technology. So it's a little scary for people to think, but soon the technology will be there that you are not in the room with the patient. Somebody is in the room with the patient, but the surgeon will not be in the room with the patient. That technology will be here within 10 years. I guarantee you. If not,
that's wild. That's definitely for another episode. That is wild.
So tell us about the No You Studio. What was the birth of that idea? And was there a gap that you kept bumping into as a physician that no one was yet filling? Let me repeat that. Please tell us about the No You Studio, about the birth of that idea, and what gap are you filling?
So when I read your question about that, I said, how am I going to explain this? Because to be honest, and I came up with a really succinct way, the No You Studio is really a letter of encouragement to myself.
Oh, I love that.
And I had to put it into terms because I came up with this, oh, let's do the fibroid fixer. And I, that's really fun for me. I really have fun with those patients. I have fun with the robotics. I have fun with that. And when I started it, I said, why am I doing this? There's people doing this. I shouldn't be doing this. No, nobody wants to hear from me. And
Why not you? But okay.
Right.
I just couldn't figure out, but why me? And my social media manager, she's one of those millennials, and she's so smart. I just love it. But she was like, why not you? And I said, that's not good enough to, whatever. So one day I was walking down the street and I was very discouraged about the whole fibroid fixer. I was like, this is silly. Why am I doing this? And later that day, I went to sleep and I clearly heard God say, no, you. And I was like, what? And it started to resonate with me that I need to just kind of, as they say, do you. And
Yes.
I was trying to figure out what that meant. And I just kept going with this phrase, know you. And so it's funny because it really didn't have anything to do with the patients it really became me trying to encourage myself, saying it's okay to do something that's different, that's scary, that is out of my lane. And then I said, well, how can I kind of make fibroids bigger? Because we can't just talk about fibroids every day for the next like 95 years. And I realized that I may not be the only person who's just trying to figure out how do I get to know me? And that means know my body. But it also means know my mind. It also means being comfortable with the fact that, maybe I'm not the most this or the most that, but I may still have a voice. So I kind of sum it up to say it's a letter of encouragement to myself, but I still think it has a bigger umbrella than that. So it's a work in progress. Exactly. I've got
As
a lot
we
of
all
thoughts
are.
about it, but
Yeah.
yeah. So that's what that is.
Well, love the vision, love the way that it was revealed to you, and look forward to the future of that. And so many of us need to appreciate who we are just as we are, but also, as you said, know ourselves in all forms. So love that for you. So you're blending medicine, media, the mission, and you just kind of express some of what I've felt as well. So a lot of physicians will say that can risk our credibility. Like we're known, our identity as being a physician and in the office, in the operating room, and that's it. How do you navigate this internal tension between being this trusted clinician in the office and now stepping into this role as a founder and a speaker?
That was very important to me. I didn't want to, lose credibility. It's very important, even though I don't watch the post, it's very important to me what she films or what I put out. I'm meticulous. Oh my gosh, is there a patient, any identifier? I'm just meticulous about that.
Yes.
I'm meticulous about asking patients for their consent. Can I use this for public education and getting that? Because I respect that. For first and foremost, I am their doctor. I want them to be proud that I'm their doctor, not like, what is that crazy lady over there talking about? So I think it's just being mindful of what your ultimate goal are and who you're ultimately trying to serve. And I think that when I think of it that way, then it's pretty straightforward. I was trying to do something with this. I take a probiotic. And so they were like, oh, you can sell this to people. And I said, I think it's a good probiotic, but I felt funny about that. So I said, you know what? I'm not going to do it. If it comes up organically and people ask me, fine. But I just couldn't just push it. So I think you just have to do what is true to yourself and feeling comfortable and making sure that you are, knowing who you are and being true to the people that you are with every day, not just people that see you doing some TikToks here and there.
So if there's a woman right now that is listening who has felt kind of dismissed or minimized or told that her pain wasn't real or wasn't as bad as she described, what would you say to her and as far as how to find the best position for her?
So I think the really great thing about social media is that people are seeing all the different ideas out there. And I think to your point, it's less concerning. There are more trusted clinicians out there now, so it's not as weird for people. But I think if you just get a little basic education, just basic, it doesn't have to be, it's just like, I know where my uterus is. And then you keep seeking doctors. There will be a doctor who's right for you. And yes, there are a
Yeah.
lot who are just saying crazy things to people. Take your notes. I always tell people you go to the doctor, take a notebook or your phone or whatever you do. Really, a notebook I think is better because I think people do better when they write things. And listen to how the doctor's talking to you. Ask them the question, how can I learn about this more? Because our time is short. We only have really, it's not 15 minutes. We know that. We
Right.
might have 7 minutes to talk to somebody. So as a patient, you should be asking the doctor, where can I learn more about this? You've given me some highlights and we're going to have a follow-up appointment, but where do you trust me to go? I think that
I like
as
that.
clinicians, we have to acknowledge people are doing Google searches, right? We used to all say, don't do
Or
Google,
Chat
don't do
GPT.
Google. They are. You know what I say? Do Google, but show me what you Googled. And then when you show me what you Googled, then I can say,
Right.
don't look at that one, go to that one.
Yeah.
So if
Yeah.
we just acknowledge that, then we can guide our patients to be in the space where they belong, not in the space of the disinformation that's out there.
Very good. Love that advice. And I would add that if when you're looking for a provider, looking for someone that gives you that feeling of autonomy, where it should be somebody that's educating you and giving you options, and typically more than one. And there are obviously circumstances where this is really the best route for you, but at least in circumstances like fibroids, there may be options. And I think that's important. And people tend to respond better, even if at the end of all of that conversation, they may ask, well, what would you do? Then it's at least they've been informed about all of the options, which I know that's what you do. And so love that, what you're doing for women and all the education. So if there was one question that every woman should be asking her OBGYN that probably most women never think to ask, what do you think that would be?
I really think it's where do I go to get more information? Because we just don't have time to talk to patients. We just don't have that much time. And they're going to look for it. I think if patients would ask their doctor, who do you trust? What sources do you trust? Then you know that even though I can't fill in all the gaps, at least I'm sending them somewhere that's reasonable so that when they come back to me, we can have a real conversation. And then the next question to ask is, what are my options? In fibroid, that's huge because people are told either live with it or get a hysterectomy, and that's not true.
Right.
And then the last thing is, okay, I hear all my options. What if I just choose to do nothing about this? Whatever your particular medical problem is. And they might say, well, your life will be fine or your life will be in great harm. But I think if you kind of go with those three things, then you leave informed and then you're able to make the decision that makes sense for you.
Yeah, I love that. That's
absolutely.
That's really important. So you certainly pour into all of your patients early. Can you tell us what is your self-care routine and how do you stay well so that you can do all of your other endeavors?
I don't. I'll be honest. Don't.
We like truthfulness, yes.
Absolutely.
So if you were going to,
If I was going
do you
to,
endeavor to do something? What is it?
I think honestly that that's a work in progress. So the things that I do every day, I try to make sure I start every day with a prayer because I can't keep moving. And sometimes it's just laying in the bed like, okay, let's get going. And then the best habit that I have is I'm a water drinker. I don't drink any other drink. Now, I wish I could tell you I ate well. I don't. I wish I could tell you I exercised every day. I don't. I wish I mean, I honestly think self-care is this wonderful idea, but I also recognize that it's a challenge. It's a challenge for me to do self-care. I love to travel, so any chance I get to go somewhere, I am going. I just pretty much no place that I won't go at least once.
Is
Someplace.
that not a form of self-care for you, though?
It
Your
is.
travel?
It is. It is.
Yes.
That is my self-care. I just can't do it as often as I like, but it is, it gives me great joy and entertainment. And it just, seeing the world is just, it's amazing to me, seeing how the world is, how other people live, how other people view other people, ideas.
Is there a favorite place that you've been to so far?
I knew you were going to ask me that.
Of course. Walk right into that one.
I mean, there's so many places that I just love. I love Cape Town. I love Japan. I love Vietnam. I mean, they're just these places. They're so different, and just like meeting different people. And so I don't have a favorite place because I really truly get something out of each place. There's some places I would not go back. I won't mention those.
Okay.
There's some places I definitely, you couldn't pay me to go back. But most places, given the, time and money, no constraints, I can get something out of every place.
But that means you've traveled enough that you know your favorites and where you did. So that's impressive. So are there, in this self-care space and arena, are there any non-negotiables you've built into your life to protect your peace?
I haven't. And I think it's awesome that you're asking that question, because I'm like, wow, this is kind of how No New Studio is. And I'm like, why haven't I done that? I'm old enough to have done that. And that's why I say it's still a work in progress of really being able to, I'll give you an example. I just came off of literally 12 days of call. And it was not an easy call. It was like, it was not an easy call. And people were like, well, why did you do that? And I said, well, this one couldn't work and that one couldn't work. And even, my partner was like, so why does it have to be you? And
That question.
At the end, I was like, that's because so I'm still in that mode of, well, somebody's got to do it. And
It does not have to be you. The system sometimes has to fail in order for them to make the appropriate allowances and to do what's necessary to take care of the patients, but then also the people, the physicians that provide the care.
Yeah.
And when we always step up to do something to fill that gap, then no one has a real sense of the consequence of when Dr. Pierre or Dr. Walker or Dr. Morris don't show up. So I too have been guilty of that. Well, no one else is doing it. I guess it'll be me. Not anymore.
Yeah.
Yeah.
So I'm working on that.
Okay.
All right. We'll put that in your No You studio for sure.
That is about.
For sure, because you don't get that time back. So,
No.
well, I love your honesty. You are exactly the person I knew you to be. I don't know, we're not going to say it's over 25 years ago. And we cannot wait to see what is going to blow up on TikTok. But I have been following your Instagram. I love the colleagues that are out there just putting out accurate, informative information, because we're living in a social media world. So whether we think it's hokey or not, it is real. And we have a lot of our patients that are coming in because of what they're seeing. And so to have a trusted voice is really valuable. So we thank you for what you're doing. And I have to say, the whole conversation just moved me because I know you personally, but because of what you're doing in women's lives. You're proof that when a woman knows her worth and her purpose, there's no ceiling to what you can do. And we thank you for working every single day in the operating room still, which is a blessing, particularly for women with fibroids. You're working in your studio, knowing yourself and helping other women know themselves. And on every stage that you stand on, and I can't wait to be in the audience for one of those. So We appreciate you.
Absolutely.
Thank you. Thank you guys for your endeavor. This is amazing. I'm like so proud of you. I'm so proud of Angela. I'm like, when
It's
I saw
fun.
it a couple of years ago, I was, it was pretty, I'm like, what's Angela doing? I'm like, you have to go to her podcast and see just all that she's doing. So it's cool.
It's interviews like this that I mean, for Sylvia and I, it's everything. It's therapy, it's motivation, it's inspiration. So yeah, it's a blast. So this is part of protecting my peace, is being able to do the podcast. So thank you.
And we learned something from every guest.
I can imagine. That's fun.
It's just fantastic. And we thank you. So Dr. Pierre, where can people find you on TikTok, on Instagram, on
The
Facebook?
Fibroid Fixer.
Love it.
Fibroid Fixer.
The Fibroid Fixer.
Yeah, and all things. I'm not on Facebook actually, but maybe I'll get encouraged. But on Instagram, and then the YouTube channel is No Use Studio. But Instagram and TikTok, it's the Fibroid Fixer. It's short and sweet.
Awesome.
Beautiful. And we will
include that in our show notes. So please go tap, follow, and share this episode with every woman in your life who needs to hear it.
Thank you. Thanks so much. It was so cool. I'm glad I could be part of this. Thank you for inviting me.
To everyone out there, if you love today's episode, and how could you not, please subscribe, leave us a review, and you can also listen to all of your episodes on YouTube. New episodes drop every Wednesday. And until then, may you be well.
May you be well.
That's a wrap on another episode of Boss Leap. May this conversation enlighten your path toward personal growth and professional empowerment. For more thought-provoking and eye-opening discussions like this one, head to our website at bossleappodcast.com. Always remember to celebrate your wins and trust yourself. A positive mindset can push you out of your comfort zone and into far greater heights. Until next time, may you be well.
Before we go, there's one more thing the lawyers have asked us to include. It's the legal language, and you know how doctors love lawyers. This podcast is presented only for educational and entertainment purposes. Although we are doctors, on this show, we are just your friends. This podcast is not intended as a substitute for the advice of your physician, professional coach, psychotherapist, or other qualified professionals. Understood? Awesome. We'll see you in the next episode.